Hi and welcome to Precision Hormones. If you're considering hormone replacement therapy, here's what you need to know. For men, hormone replacement therapy involves testosterone or TRT. For women, we focus on estrogen, progesterone, and testosterone. These hormones are present in our bodies from birth, surge during puberty, and peak in our early 20s. Women typically reach menopause around age 51, marked by 12 consecutive months without a menstrual cycle, and perimenopause can begin a decade earlier, with hormone levels decreasing and symptoms like insomnia, hot flashes, low libido, mood changes, and more. Hormones play a crucial role in protecting our bones, hearts, breasts, and brains. They help prevent osteoporosis, heart disease, certain cancers, and dementia. At Precision Hormones, we use bioidentical hormones, which are natural and safer than synthetic versions. Hormones can be administered via troches, creams, injections, or pellets. We will discuss the best method for you during your consultation. Whether you want to monitor your levels or start replacement therapy, the first step is to check your hormone levels through a lab test. For patients of Nebraska weight loss, we're offering a discounted consultation and lab review for $110, down from $150. If you're ready to take the next step towards better health and well-being, schedule your appointment with us today. You can click the link in the description box below to schedule.